Okay, so we're going to go ahead and continue our assessment of the musculoskeletal system. We were last talking about the hip. We had started by inspecting the hip alignment through the inspection of the iliac crest, and also looking at the gluteal muscles to see if there was any asymmetry there. So now we're going to go ahead and jump into the range of motion assessment of the hip. So to begin, we're going to go ahead and ask the patient to go ahead and perform a hip flexion where he is going to raise his legs and go ahead and bring them up as far up as he can, attempting not to bend the knee in the process and attempting to keep this leg down as far as he can. And normally you can bring it up about a 90 degree. Okay, so this is a little less, that's okay. And then we're going to go ahead and do our other one. Should be about 90 degrees, and then bring it down. And now what we're going to do is we're going to ask him to get into the prone position so that we may assess a hyperextension, where he will bring up the legs in just the same manner but going backwards. So each one should be at least 30 degrees or less. So now bringing him back into the supine position, we're going to go ahead and ask him to place his legs straight forward, and then go ahead and ask him to bring his knee to his chest as far up as he can. Now this should be about 120 degree angle that you perform this at, and then do the other leg just as well. Again, we are assessing to make sure that there is no problems as the patients are doing this, and that they have coordination and fine motor movement when they perform it. Now we're going to go ahead and ask the patient to keep his legs straight and then attempt to bring it outward as far as he can. When he does this, this is the assessment of the abduction of this hip joint. And it should come up about a 45 degree angle, which is just about where we're at. And then go ahead and bring it back. Go ahead and perform the other side just as well. And then go ahead and bring it back. And then we're going to go ahead and ask him to go ahead and abduct the same hip joint and move his foot into the medial side as far as he can, medial going inward. So lift and keep your legs straight, lift and go as far inward as you can, okay? And normally you'll have about a 30 degree angle when you are able to do that, and go ahead and perform it on the other leg as well. Okay, so then we're going to ask the patient to keep his foot on the ground while he bends his knee, and then we're going to perform an internal rotation assessment where he is going to bring his knee inward. Now, this should give you about a 40 degree angle, and then we're going to perform an assessment of external rotation where he's going to bring the lateral portion of his ankle to the opposite knee, and then kind of attempt to bring down this knee down to the floor. That would be your external rotation, which should give you about a 45 degree angle. So that, while he's performing that, what you could do is you can go ahead as he's doing this, and he should try to attempt to push down while you're pushing up to test muscle strength. And then, just the same, ask him to go ahead and place his knee, his foot down on the ground, and then ask him to go ahead and attempt to internally rotate the knee as you press outward. And then you can also do this in all of the exercises as well, just as when he is attempting to flex the knee towards his chest, you can attempt to push forward as he's doing that. So go ahead and do that. Go ahead and bring your foot forward, bring it to your chest, and I'm going to use opposing force. And then you can also ask him to go ahead and bring his knee down, and as he's trying to bring his leg upward, go ahead and bring the leg upward. You can try to bring it down just like that. Just putting resistance in all of these exercises, seeing what degree of muscle strength he has. Again, grading it from a 0 to a 5. 5 being the best case scenario, 0 being the worst, where the muscle is just flaccid. Now, we're going to go ahead and move forward into the examination of the lower extremities. So we have already performed assessment of the upper extremities, the spine, the hips. Now we're going to continue with the lower extremities. So we're going to start out with the legs and the knees. Now, this is a very common area that people complain about, whether because they're in sports or with age. These are the joints that are very susceptible to having injuries, just because that is where most of the weight of the body lies when we are standing or sitting. That is just where gravity pulls all of that weight into. So especially in your very obese patients, you'll see that they have degradation of the areas of the joints, whether it's in the cartilage, cartilaginous tissue, or in the fat pads, or in the meniscus area in the knees, or in the bones themselves. So you will note that these are areas that have that are very prone to injury in almost any patient. So in order to begin, again, we're going to go ahead and lift the shorts on this patient here so we can take a better look at the knees. So we have the knees here. It's better if we have the patient laying down. That way we can have the legs straight out and we have a better look at the knees themselves. So we want to begin by inspecting the knee. Now, just by looking at it, you want to take a look at the skin and the subcutaneous fat, like we had stated earlier. You want to see if there is any swelling that's notable, any notable nodules. You want to make sure that you can observe the concavities of the knee pretty well, and make sure that there's no redness that you see or any other type of abnormality. Once you're done inspecting the knee, and also making sure that there is about anywhere from a 0 to a 15-degree angle between the femur and the tibia, no more than 15 degrees, you can move on to that palpation portion of the knee. So in this case, we're going to go ahead and review a little anatomy here. So we have to understand where the major landmarks of the knee are in order to understand what we're palpating. So the femur is the bone here that actually joins with the hip bone here. So this bone, this big bone here in the thigh, is called your femur. And if you follow it downward into the knee, okay, sometimes you'll have to bend the knee a little bit. You should be able to feel the epicondyles of that femur along the sides of the patella here, this big bone overlying the joint. And right in the medial portion, you should feel another protrusion here, which we call the adductor. The adductor protrusion here. So that is the adductor space that we're talking about. And then this is the patella here, like I said before. And then the tibial tuberosity is the next bone that we see, and it lies right below the patella, and you can feel it very well right here. And then this bone that runs in the front of the leg is called your tibia. There is another smaller bone that lies behind the tibia, also joins in at this area of the femur and tibial joint, and it's called the fibula. This one you can barely feel here at the lateral portion of the knee, but then it's very hard to feel going down, especially in patients that have a lot of muscle in their calves. You should be able to feel the suprapatellar pouch here, just right on top of the patella. You should also feel concavities below the patella and to the medial portion. You should also run your fingers behind the knee. This is called the popliteal space, where the popliteal artery lies. So you could even feel the pulse there. And you should not, this patient should not feel any tenderness, and you should be able to feel the groove there pretty well without feeling any swelling or edema. You should not feel any masses, nodules, and especially when you move the knee, there should be no crepitus or other types of abnormalities. The contour should be smooth and bilaterally equal. When you're feeling the muscles and you're feeling the different grooves here. They should be firm and smooth. So all of these things are things that you need to look out for whenever you're inspecting and palpating the knee. So now we're going to go ahead and assess range of motion. So we're going to go ahead and ask the patient to go ahead and flex the knee. Now, when we flex the knee, we're probably going to ask him to raise his leg up just like this and try to flex it as much as he can while keeping his foot on the floor. Now, this is probably better when standing, but we're going to go ahead and do this for sake of not turning off the video right now. But you should have bending of the knee of about 130 degrees. And then we're going to go ahead and ask him to hyperextend the knee. So extend it as far much as he can and upward as much as he can. And this should provide him with at least 15 degrees of hyperextension, where when he relaxes it, that's at 0 degrees. And then we're going to go ahead and, as he's doing these types of things, we're going to go ahead and provide opposing forces. So, meaning when he is attempting to bring the knee and bend it, I'm going to put force against it so that he doesn't. So go ahead and do that. Try to bend your knee, and now try to extend your knee. Okay. So that's how you assess the muscle strength. So we're going to end this video with that portion. We're going to continue the next video with the feet and the ankles. So tune in for the next one.